You know that moment when you're sitting there enjoying this incredibly rich biryani, or maybe you're taking a sip of a perfectly brewed evening chai, and then suddenly crunch.
Oh, yeah, the dreaded crunch.
Right, you've bitten directly into a whole green cardamom pod. And for a lot of us, it is just this intense, almost overwhelming explosion of flavor. It completely takes over your palate.
It really does. It's like a culinary ambush.
Exactly, culinary ambush. And you usually end up just like picking it out and leaving it on the side of your plate. But, well, what if I told you that the tiny green spice hiding in your rice is actually a highly sophisticated botanical medicine?
Which sounds like an exaggeration, but it really isn't.
It's not. The
Ah.
ancient Egyptians and early Ayurvedic masters were frankly completely obsessed with it. And modern clinical labs are just now figuring out the microscopic reasons why. So today we are doing a deep dive into a fascinating stack of sources, all centered on cardamom, or Elateria cardamomum.
Also known historically as the Queen of Spices, which is a great title.
It is. And our sources today span thousands of years, right, from ancient texts all the way up to clinical studies published between 2019 and 2023. Our mission for this deep dive is to basically separate culinary tradition from clinical fact. We are going to unpack the specific bioactive compounds in cardamom, figure out exactly how and when you should use it, and this is important, identify the hidden dangers for people who should avoid it entirely.
Right, because we tend to categorize things strictly into, food or medicine, but looking at the timeline of cardamom, nature rarely draws those lines cleanly.
Yeah, before we even look at the modern lab results, we kind of need to understand what this spice actually is.
Yeah.
Like, why were ancient civilizations so obsessed with it?
Well, to understand that, we have to look at its origins. It's native to the Western Ghats of South India and the really wet highlands of Sri Lanka.
And the sources mentioned Sri Lanka still produces the best quality, right?
Yeah, exactly. Even though, interestingly, Guatemala is now the world's largest producer by volume today. But Sri Lanka still holds the crown for the highest quality, most potent pods.
So visually, the plant itself, it has these long leaves and small white and blue flowers.
Yeah.
But the magic isn't in the flowers at all.
No, not at all. The biological payload is completely locked away inside those tiny, highly aromatic black seeds that are just hidden inside the green pods.
Okay, let's unpack this, because the ancient world clearly knew there was something special in those seeds. The Ayurvedic texts from thousands of years ago were using it for irritable bowel syndrome, indigestion, and heartburn.
Right. And meanwhile, you have the ancient Egyptians chewing the pods to clean their teeth, and the Chinese using them to cure bad breath.
It's basically the ancient world's all-in-one breath, mint and antacid, but with a highly complex chemical payload.
That is a perfect way to describe it, because they were utilizing it for these highly targeted reasons without knowing anything about the underlying chemistry.
He just knew it worked.
Exactly. But modern microscopic analysis has finally broken down those little black seeds, and the chemical profile is just, it's astonishing.
Yeah, the list of compounds in the sources is massive.
Yeah. It is. We're looking at things like cineol, terpenyl acetate, limon linalool, plus a ton of flavonoids, polyphenols, manganese, and dietary fiber.
That sounds like an entire pharmacy in a seed.
It really is. The ancients were blindly utilizing these rich polyphenols and terpenes, and we now know that polyphenols act as like cellular shields that neutralize damage.
Well, the terpenes are the ones with the strong smells, right?
Right. Terpenes like cineol and linalool give plants their aroma, but they also carry these really aggressive therapeutic properties. These specific chemicals are the exact drivers of the medicinal benefits those early doctors were seeing.
You know, when I first read in the sources that the Egyptians were chewing it for oral hygiene, I kind of rolled my eyes a bit.
I think a lot of people would. It sounds like folk medicine.
Yeah, anything strongly scented citrus, mint, it's going to mask bad breath. I just assumed it was no different than popping a piece of commercial gum after eating a bunch of garlic.
And that is such a common modern assumption, but it fundamentally misunderstands what those specific terpenes are doing on a microbial level.
Which is where the new science comes in.
Exactly. What's fascinating here is that modern clinical science from 2020 to 2023 has finally proven how this works. Cardamom extracts have aggressive antibacterial effects against oral pathogens.
Wait, so chewing a pod isn't just releasing a nice scent like commercial gum. It's actually deploying a targeted antibacterial strike force in my mouth.
Yes. Let's look closely at the mechanism of a compound like cineole. So cineole is highly lipophilic.
Meaning it's attracted to fats.
Precisely. It interacts directly with the lipid membranes of the bacteria in your mouth. It basically wedges itself right into the bacterial cell wall.
Oh, wow, so it physically breaks them down.
It compromises their structural integrity until the pathogen literally bursts. It doesn't just mask bad breath, it actively fights the bacteria, causing periodontal infections and tooth decay.
That is wild. It's actively altering the microbiome of your mouth by destroying the pathogens that make those awful sulfur compounds.
And it gets better because it's a seed that you chew and mix with your saliva, right? So that therapeutic action cascades downward.
Oh, right, the gut-mouth connection.
Exactly. The moment those terpenes hit your saliva, they send this chemical signal down to your stomach. Your gastrointestinal tract actually starts secreting digestive enzymes and gastric juices before the food even arrives.
So it's prepping the entire digestive pipeline. Like, it sanitizes the entry point in the mouth and then chemically nudges the stomach to wake up and get the digestive acids flowing.
Which perfectly explains why Ayurvedic medicine was so confident in prescribing it for bloating, gas, acidity, and stomach pain.
Because it's preventing the indigestion from happening in the first place. It's making sure your stomach is fully equipped to handle whatever you're about to eat.
Exactly. But treating an upset stomach makes sense. The sources take a really surprising turn when we look at what happens after those compounds are absorbed through the intestinal wall and actually enter the bloodstream.
Right, because this is where it stops being just a digestive aid and becomes a systemic biological intervention. Let's talk about the heart, because the sources show that cardamom essential oil helps restore lipid homeostasis.
Yeah, and to break down homeostasis for a second.
That just means a state of equilibrium or
Yeah.
balance, right?
Exactly. It's not just wiping out all your cholesterol, because your body actually needs cholesterol for cellular function. It's keeping the different types of circulating lipids in a healthy ratio.
And it lowers blood pressure, too.
It does. The active compounds act as vasodilators. They relax the smooth muscle cells lining your blood vessels, which naturally widens them, lowers blood pressure, and improves overall blood flow.
And the kidneys get a huge boost from this, too, specifically from a compound called geraniol. The sources say it increases antioxidants and reduces stress in the kidneys. And I wanted to get into this, reducing stress sounds a bit vague.
It does sound vague, but the mechanics are very specific. Your kidneys are the primary filtration system for the blood, right? They process quarts and quarts of fluid every day.
Which has to be an exhausting process for those cells.
It is a metabolically expensive process. It generates metabolic exhaust in the form of free radicals. If those free radicals just build up, they cause severe cellular damage to those delicate renal pathways.
And that's where geraniol comes in.
Yes, geraniol operates by stepping into those renal pathways and acting as a targeted scavenger. It increases the local concentration of antioxidants, which basically donate electrons to neutralize those free radicals before they can degrade the kidney tissue.
That's incredible. It's providing a localized protective shield for your body's filtration system.
Yeah.
And we even have recent adult clinical trials backing this up, right?
Do. Daily intake of about 3 grams for several weeks showed measurable improvements in blood pressure and inflammatory markers in adults.
Though the sources are careful to note that larger clinical trials are still needed before it becomes like a standard medical prescription.
Right, but the early data for cardiovascular impact is very real. And the clinical data becomes even more robust when we look at type 2 diabetes.
Oh, this was one of my favorite parts of the sources. Here's where it gets really interesting, because cardamom is incredibly effective, but it turns out it's a massive team player.
It really is. The synergy is amazing.
Yeah, the research highlights this specific combination where cardamom works incredibly well when combined with saffron, ginger, cinnamon, and probiotics to help control type 2 diabetes. It kind of reminds me of a botanical superhero team.
A superhero team, or honestly, a highly coordinated heist on the metabolic system. The pharmacokinetics of that combination perfectly match a coordinated operation.
Okay, I love the heist analogy. So if it's a heist, cardamom is basically the lockpicker. It goes in and improves cellular insulin sensitivity, which unlocks the doors to the cells so they can receive glucose.
Exactly. But cardamom alone isn't enough to pull off the job.
Right, so ginger steps in and disables the alarm system by lowering systemic inflammation, because inflammation often blocks insulin signaling.
Yep, and then cinnamon throws open the vault. It actively slows down the rate at which glucose is absorbed into the bloodstream from the gut.
And then saffron is the getaway driver. It protects the pancreatic beta cells, the ones that actually produce the insulin from oxidative damage.
And you can't forget the probiotics, which basically ensure the entire operation has a safe, smooth route through a highly functioning gut microbiome.
That is so cool. They all work together rather than acting as a solo cure.
And that chemical synergy is exactly why traditional cuisines naturally pair these spices together. They interact to make the body way more responsive to insulin than any single compound could do on its own.
So if these compounds are circulating in the blood, relaxing vessels and scavenging free radicals in the kidneys, I mean, the next logical question is, can they protect the brain?
Yes, and that brings us to the most unexpected finding in the sources: neuroprotection.
Because there's this breakthrough study from 2019 that completely changes how we look at this spice.
It really is arguably the most significant finding in modern cardamom research. The study demonstrated that cardamom essential oil has powerful neuroprotective effects.
Meaning it physically protects nerve cells in the brain.
Exactly. It reduces oxidative damage in the brain caused by severe neurotoxins, specifically analyzing the damage from things like aluminum chloride.
We should probably explain oxidative damage in the brain a bit. Because it's not just like rust on a car, it's a dynamic biological process. The brain consumes massive amounts of oxygen and energy.
Right, and that constant metabolic engine produces those rogue molecules we talked about, free radicals, that bounce around violently.
Because they're unstable molecules missing an electron, right?
Exactly. And in their desperation to stabilize, they will literally rip an electron from the nearest healthy nerve cell, causing structural damage.
Ouch. And when a neurotoxin like aluminum chloride gets introduced,
It triggers an absolute storm of these rogue molecules. But if we connect this to the bigger picture, the 2019 study showed that the polyphenols in cardamom essential oil actually cross over and act as a dense antioxidant shield within the brain itself.
so they voluntarily hand over their own electrons to stabilize those rogue molecules.
Yes, they neutralize the threat before the delicate nerve cells get compromised. It acts as a shield for the brain, not just the body.
That is amazing, though we need to be incredibly clear here. The sources explicitly state this is not a cure for Alzheimer's or dementia. No one should be throwing out their medication.
Absolutely not. It is entirely preliminary early evidence. But what it does provide is highly promising building blocks for future neurological research.
Okay, so knowing that it acts as a bacterial destroyer in the mouth, a digestive catalyst, a vasodilator, and an antioxidant shield in the brain, that's amazing. But it brings up a practical issue.
The dosage.
Yeah, now that we know what it does, how exactly should you consume it to get these specific benefits without overdoing it? We need a learner's how-to guide for cardamom.
Well, the biological consensus across all the sources is incredibly clear. More is not better. The daily dosage is just 1 to 2 pods, which is roughly 1 to 3 grams.
That's it. Just 1 or 2 pots a day is plenty.
That is plenty. Exceeding that really doesn't amplify the positive effects.
Okay, so with a strict limit of 1 to 2 pods a day, how you prepare it should really depend on what you're trying to target. It's like building a personal spice toolkit based on your daily needs.
Exactly. So if your goal is oral health for fresh breath or just getting the nervous system to calm down for good sleep, the preparation is super simple. You just chew 1 to 2 raw pods or crush them and steep them in warm milk right before bed.
So the raw pods release the terpenes into the saliva, and the warm milk acts as a lipid carrier to absorb the calming compound.
You got it. But if your target is gastrointestinal, like if you're dealing with bloating, heartburn, or sluggish digestion, you want to extract the compounds into a tea.
And the sources give a specific recipe for that, right?
They do. Crush 2 pods, drop them into about 200 milliliters of water, and boil it for 5 to 10 minutes. You want a sustained boil to fully release the polyphenols.
And when do you drink it?
Consume it 30 minutes after your meals and cap it at a maximum of twice a day.
Simple enough. And you can also use that concept of synergy we talked about earlier for targeted combos. Like for an acute immunity boost, you combine cardamom with black pepper and honey.
Which creates a highly antibacterial and throat-soothing paste, yeah.
And for acute digestive distress, you combine it with ginger. Or for general winter wellness, brew a tea with cardamom, tulsi, which is holy basil, and cinnamon.
And you can even bypass the digestive system entirely if you want to focus strictly on respiratory protection through aromatherapy.
Right, diffusing a specific essential oil blend. The sources gave a golden ratio for that, didn't they?
Yes, the clinical aromatherapy ratio for respiratory antibacterial benefits is 10% ginger oil, 68% cinnamon oil, and 22% cardamom oil. Inhaling that allows the terpenes to interact directly with your lung tissue.
Wow. And of course, just utilizing whole pods in traditional cooking is perfectly safe too, right? Like putting in payasam, biryani, kurma, or even your coffee.
Oh, absolutely. Cooking with it is a perfectly safe way to maintain a baseline of polyphenols.
But, and this is a big but, we have to address the red flags. Because just because something is natural doesn't mean it's safe for everyone.
Exactly. Plant medicine is still medicine. It dictates actual chemical changes in the body. We need a crucial reality check here.
So let's look at who should stay away. Because there's a fascinating paradox with gallstones. So what does this all mean for someone with gallstones?
Well, the gastrointestinal benefit of cardamom comes from its ability to aggressively stimulate digestive glands, right? And one of its primary targets is the gallbladder.
It forces it to produce bile.
Right. It forces the gallbladder to contract and secrete a rush of bile, which is great for breaking down a heavy meal. But if a patient has gallstones, forcing the gallbladder to violently contract against those stones will trigger severe, excruciating colic pain.
That is such a wild paradox.
Yeah.
The exact mechanism that makes cardamom so great for normal digestion is the precise reason it becomes a dangerous trigger for a gallstone patient. It's a real reminder to respect plant medicine.
It really is. And we also need to talk about surgery and blood thinners. Because those bioactive compounds act as vasodilators, they inherently delay the blood clotting process.
So if you're scheduled for surgery,
You must stop all medicinal cardamom intake at least 2 weeks before the operation. And anyone actively taking blood-thinning medications like warfarin needs explicit clearance from a doctor before using cardamom as a daily supplement.
because it could dangerously amplify the effects of the medication.
Mm.
And that vasodilation effect also means people who suffer from chronically low blood pressure need to avoid high doses, right?
Yes, because it naturally lowers blood pressure, it will push their BP even lower.
What about pregnancy and nursing?
Culinary amounts are perfectly safe, like the occasional pod in your rice. But high-dose concentrated supplements or medicinal teas must be completely avoided without direct medical supervision.
And the essential oil itself can cause issues too.
Yeah, the concentrated essential oil has highly volatile compounds that can trigger contact dermatitis or allergic reactions if you apply it directly to the skin without a proper carrier oil.
Right. It really is a profound reminder that we are dealing with active pharmacological agents here. Which brings us to the core disclaimer echoed across every single piece of medical literature in our sources today.
Which is that cardamom is an incredible support system, but it is not a magic standalone cure for any disease.
It can't reverse the effects of a destructive lifestyle.
Exactly. It reaches its full therapeutic potential only when it operates in tandem with a proper diet, consistent exercise, and good sleep. It is an extraordinary botanical assistant, but it cannot outwork chronic sleep deprivation or a highly processed diet.
It's an assistant humanity has relied on for millennia, though. And that leaves you with something really fascinating to ponder as we wrap up this deep dive.
Oh, definitely.
We just broke down how ancient Egyptian dentists and early Ayurvedic practitioners were able to pinpoint the exact localized medical applications of this plant. They knew it cured gum disease, aided digestion, and reduced inflammation thousands of years before the invention of the microscope.
They mapped its benefits long before anyone could identify a compound like cineol or geraniol.
Right. They just observed, documented, and knew that it worked. It makes you wonder what other common everyday kitchen staples sitting silently in your pantry right now are hiding highly targeted medical interventions that modern science just hasn't fully mapped out yet.
I mean, the most advanced apothecary you own might just be sitting right there on your spice rack.
Exactly. So the next time you're eating biryani and you accidentally crunch down on that intense whole green pod, maybe don't spit it out. Your mouth, your gut, your heart, and your brain might just thank you for it.